Welcome to the Explainer. So, it's been a few years since the pandemic really kicked off, and you know what? A whole lot of analysts, doctors, and commentators are now going back and re examining the very data that shaped, well, everything. And what they're finding is raising some pretty serious questions. A number of sources are now asking some really critical questions. They're looking at the very foundation of the pandemic numbers, and they're starting right at the beginning with the diagnosis itself.
Okay, so this number, 86%, this is really at the heart of the whole controversy. This comes from a German study that was highlighted by Dr. John Campbell, and it alleges that a staggering 86% of the PCR tests were actually false positives.
Right, so let's dig into that. The absolute cornerstone of the entire pandemic response was the PCR test. But here's the twist. Its own inventor reportedly had some really serious doubts about using it to diagnose infectious diseases. And that brings us to this quote, which is attributed to Kary Mullis, the Nobel Prize-winning inventor of the PCR test. Now, as the Jimmy Dore Show pointed out, Mullis was a pretty big critic of Dr. Fauci, and he basically argued that his test, while it's super powerful, it can't actually tell you if you are sick. And this slide just lays it all out side by side. On one hand, you've got the official estimates from places like the Lancet and government bodies, right? They're saying the false positive rate was super low, somewhere between, say, under 2 to 5%. But then, on the other hand, you have this one German study suggesting the real number was a jaw-dropping 86%. And if that 86% number is even close to accurate, the implications are, well, they're enormous. It would suggest the sheer scale of the infection was just massively inflated. I mean, think about it. If the study is right, for every 10 people told they had COVID, maybe almost 9 of them didn't. Okay, so if the diagnosis numbers are potentially shaky, what about the death toll? That's the next logical question, right? Well, critics are pointing to a couple of things that might have inflated these numbers too. The treatment protocols and, financial incentives. So, a segment from the Russell Brand show detailed this. Apparently, there was a change in UK medical guidelines back in 2020. They recommended using both morphine and midazolam together for COVID patients, especially in care homes. The thing is, both of these drugs are known to suppress your breathing. Giving them to someone who's already struggling to breathe, well, that's a pretty dangerous combination.
And this is where it gets really interesting. An analyst named Wilson Tsai pointed out this correlation. He found that as shipments of midazolam went up, a spike in excess deaths followed about a month later. It suggests the treatment itself might have contributed to those excess death numbers, which could have made the virus seem even more deadly than it was.
Then there's the money angle. The channel Redacted highlighted this story about a family that was actually upset a death wasn't listed as COVID-related. Why? Because they would have gotten $7,500 from the government for funeral costs. It just makes you wonder how many other deaths might have been classified differently for financial reasons.
So, we've talked diagnoses, we've talked death counts, but that's not the whole story. Significant questions have also been raised about what happened after the vaccination started and about what people on the front lines were actually seeing.
The Redacted show detailed a whole list of concerns. Some of it was officially acknowledged, like the signals for myocarditis. But there were also studies finding microclotting in patients and reports of vaccine mRNA being found in placentas and sperm, long after the shot, which kind of went against what we were all told at the beginning. And then you have these really strange reports from embalmers. It's a claim researcher Thomas Havland has been digging into. A growing number of them say they're finding these unusual white, fibrous clots in people who had been vaccinated. They say these aren't your normal blood clots. They're described as being rubbery and elastic. Just weird. And this is where it all kind of ties together. You have practitioners on the ground reporting these strange things, and then you have figures like Senator Ron Johnson making this explosive claim. He alleges that official health agencies knew about safety signals, like for myocarditis, but that information wasn't shared with the public. They basically hid the signal. Which, of course, brings us to what's become a central theme in all of this, the fight for transparency. A fight to get access to the raw data so that independent researchers can actually take a look for themselves. Dr. John Campbell laid out this timeline in the UK perfectly. Public concern starts to grow. So in 2023, a Freedom of Information request gets filed. They're asking for super simple, anonymized data. Just give us the vaccination dates and the dates of death. And as you can see, the UK Health Security Agency just refused. Then in 2024, the Information Commissioner sided with them, keeping all that data secret. And this is the official back and forth. The government says releasing the data could lead to misinformation or cause distress for the public. But on the other side, you have members of parliament saying, hold on a second. They argue the public is being patronized and, get this, denied information that private drug companies already have. So you add all of this up, the questions about the tests, the questions about the death tolls, the secrecy around the data. What's the end result? Well, it's a measurable, massive erosion of public trust. The Jimmy Dore Show brought up a figure that suggests 70%, 70, of Americans now doubt that the medical industry really has their best interest at heart. This massive level of distrust is being presented as a direct result of people feeling like they've been misled on, well, just about everything. And this is why Dr. John Campbell brought up this famous quote from George Orwell. He's framing this whole struggle over the pandemic data as a battle for the history books. The idea is, if you control the data now in the present, you control the official story of the past. And that story is what shapes all of our policies and beliefs in the future.
So the ultimate question this all leaves us with isn't necessarily whether every single one of these claims is 100% true. It's about the nature of truth itself when information is being guarded so closely. When officials say they're withholding data to protect us, we have to ask a really crucial question. Are they protecting the public, or are they protecting themselves?